Sunday, I was like, "Ooh, we're live! It says live!"
We
Woo!
don't have Oh my goodness. Hi everyone. Good afternoon, good evening, good morning, depending on when and where you're watching this Facebook Live. This is the voice and the face of Dr. Olabintan. I'm the CEO and the co-founder of Livingspring Family Medical Center here in the awesome city of Mansfield, Texas, not too far from Dallas, where we believe in helping our patients live long and well because we believe the quality of life is just as important as the quantity of life. If you are watching live, please hashtag live. And if you're watching replay, hashtag replay. I am very happy and excited to be having this conversation with a colleague, with a friend, and psychiatrist, Dr. Vineka Heeramun. Thank you so much for coming, Doc. How are you?
I am good. Thank you for the honor. I am privileged that you have have me on your platform. Thank you so much. You are a wonderful person, wonderful doctor, and I love your Facebook lives.
Thank you. And thank you for coming on. I appreciate you. I appreciate you. Now, that being said, my first question to you is this, Doc. Can you kindly introduce yourself? Who are you and what do you do?
So I'm Vineka Heeramun. They call me Dr. H because my name is too complicated, apparently. Um, I'm the CEO and founder of Joyful Horizon. We're based in Utah. We're an outpatient mood disorder clinic. We specialize in treatment resistant depression and offer medication management as well as more uh, other treatment modalities like spravato, which is the intranasal ketamine, and TMS, which is transcranial magnetic stimulation. Um, and I just have been dreaming to say this. So, quoting Dr. Tolu, copyrights to Dr. Tolu, if you're looking for a psychiatrist to make your life better, to get your life back together from depression again, I am she.
I love it. I love it. And well said. I love it. Well said. All right. So my next question to you is just, and I'm putting a post right here because one of the things I love about what you do is that you help patients feel joy and regain back their health by mastering their mental health. And I'm putting a little comment there because that's big. You empower patients to live their best life from a mental standpoint, inside out. So I love, 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 love what you do. Now, Doc, my next question to you is this though. What got you started? Like, why do you do what you do?
So what got me in the novel treatments were so I have been doing inpatient psychiatry. I've stepped down a bit now. I do fewer hours, so I can dedicate more time to the clinic. But in inpatient psychiatry, we see only a glimpse of the patients. They are there for 5 days, 7 days, and then I always wonder what's going on with the patient. How are they doing? So that was the idea of starting an outpatient clinic, but it is so frustrating to see patients going from one medication to the other and it
Mhm.
not working. They're still struggling. So I decided to incorporate transcranial magnetic stimulation, and the results have been astounding, phenomenal.
Mhm.
And then for those patients that don't respond to TMS, that's how we got started with Spravato. The patient is still in remission. It's been 1 year since I've seen the patient now.
Mhm.
She is doing still good after a few treatments of Spravato. So it's I think this is the way of the future. It's gonna more insurance. Well, all the insurances except, for example, in Utah Medicaid doesn't cover it yet,
Mhm.
but all other insurances cover it. They recognize it as an effective means of treating treatment-resistant depression, and the criteria are getting even less stringent. It used to be, for example, for some insurance companies, four antidepressant
Mhm.
trials, two different classes of medications and therapy before they approve it, and now it's leaning more towards maybe two or three. So insurance companies are also recognizing how effective those other treatment modalities are.
Awesome. I like what you do in that also, you know, treatment resistant depression is not like there's no hope. There's hope.
There
Um,
is hope. That's the
there are
thing.
options. There are options.
Because people come in and desperate. They're like, what do I need to do? Like, I've tried this. I'm tired. There's no hope for me. They are suicidal, so that gives them hope,
Mhm.
and they respond really well to it.
Awesome. Awesome. Now, for those of you who are watching, we're talking about the topic. Doc, I seem to be more depressed during certain weather seasons. Any tips? So my first question in regards to that is: are there in your line of work, have you noticed that there are seasons depression seems to peak?
Oh my goodness. It's a very timely question because last winter was really rough. Probably in most parts of the US, but in Utah, it was probably the worst winter we've had in
Wow.
40 years. Like we couldn't go to work. There was so much snow. It was lasting forever. We had snow till like the beginning of May. So we really noticed the increase in the seasonal affective disorder, which is our topic today. So to answer your questions, the peak of depression usually um, for those that have the seasonal affective disorder, because not all depressed patients will have seasonal affective
Mm,
disorder,
mm,
but towards the starting fall and early winter is when that seems to peak, the seasonal affective disorder. However, seasonal affective disorder does not only include depression. The winter depression is the most common form of it, but it can
mm,
also be the opposite. So hypomania and mania, the mood disorder encompasses that as well. So we also need to watch out for that. Like for example, there are very few cases, well, the minimal cases of the resurgence of mania or hypomania would be in the winter months, but usually the opposite, like springtime or summertime, people start having more energy. But for bipolar patients, they might actually get into a manic episode or a hypomanic episode. And also, we also have to watch out for increased suicidality because, let's say, during the winter months, the patients have less energy. They are suicidal, they are hopeless, but then they start feeling better. So it's not just that their depression will remit, but also they have energy to now act on their
mm,
suicidal thoughts.
mm,
So we
mm.
have to watch out for that too. But in general, the symptoms for seasonal affective disorder will be the predominant symptom would be that the patients would be very fatigued, very tired, have difficulty getting up in the morning. They just want to stay in bed, cover up
Mm,
stay covered under their sheets, have difficulty going to work. Some for some patients, they might also feel suicidal, but mostly it's that kind of like that drag, that lack of energy,
mm,
that
mm,
sensation of hopelessness that tends to come in, and it's kind of like a hibernating mode, sort of. So people are
wow.
more hungry and they crave carbohydrates. They're sluggish. They kind of have that mental fog where they have difficulty focusing, um, and they are the energy levels is predominantly affected.
Okay. And so I know we talked about it already, but for definition's sake, what would you say is seasonal affective disorder? I know you mentioned now that yes, there's one type in the winter, but are there different types?
So there are, it's what it stands for, seasonal affective disorder. It goes by the acronym of SAD, which is a very, because that's the predominant form of it. So, uh, but what it stands for is basically mood disorders associated with seasons.
Okay.
So it tends to be the most common form is the winter depression, where people will be more depressed in the start of winter or the during fall typically.
Okay.
But let's say we're in September and fall has just begun.
Hmm.
Patients may not notice the full effect of it till, let's say, December or January. So they initially start feeling like, oh, I'm a little tired, but probably it's work. And then as the months pass, they then have maybe the full blown depression episode.
Okay.
It's kind of like the cumulative effect, and it has to do with mostly with how short the days become. So the less light,
Right.
the amount of light during the daytime. So in as the day, so winter solstice is usually towards the end of December, but the seasonal affective disorder actually starts earlier than that, but then the effects become more predominant and more almost cumulative with people not having enough light. So the body responds to that. So then the theory behind it would be like our body secretes melatonin. So the longer our nights become, so the less the duration of the day, the more melatonin we secrete.
Okay.
So that kind of prompts us to think, oh, time to, it's still time to sleep.
Ah,
Like, well,
ah,
oh, it's not daytime yet. Like, why am I getting up? And then it also decreases the level of serotonin, which is a very important neurotransmitter, which helps with mood improvement. So those are kind of like potential theories of what's going on in seasonal affective disorder. Interestingly, it's more common, like probably 3 or 4 times more common in women than men, and also more common the further we go from the equator. So in the northern latitudes, it's Scandinavian countries or higher up in the, or closer to the northern poles or southern poles as well. It tends to be more predominant.
okay. Thank you for that. And so let's talk prevention. Is it possible to prevent it, knowing that the tendencies, is worse at certain seasons? Can you anticipate it and prevent it? Are there any tips, hacks to that?
Yeah, so the most important thing is the recognition of the symptoms. So when people start feeling more sluggish, more tired, and everybody presents in a different way.
Okay.
As I said, it's kind of like spectrum of symptoms. In the most severe form, people even feel suicidal, but in the milder forms, it becomes more like they are dragging. They have less energy. They don't want to get out of bed. They are wondering like, what's wrong with me? Well, you might have the onset of seasonal affective disorder. So, first, recognizing it, and then trying to have as much light as possible. So, even though as the day gets shorter and shorter, to try to go out for a walk. And some places you might not, see the sun for a couple of days, and in these conditions, probably getting a light box or like a SAD box, they also call it, for seasonal affective disorder. Um, and what to look for when purchasing a light box would be that it emits like 10,000 lux. So lower than that is not as effective, but 10,000 lux, that's kind of like the measurement for the light. It's white light, so people can purchase that. And then try to um, do as much self-care routine as possible, because you like it's more prevalent in patients that are depressed, but anybody can have seasonal affective disorder as well. But so what happens is that, let's say any kind of stress can affect somebody, and they have some amount of they can cope with it better. But let's say they're already now affected by seasonal affective disorder, it becomes more difficult to overcome that stress
Mm.
because that reserve is lower now, the threshold is less. So try to for example, go for a walk, keep moving, so that your body gets the signal like, okay, I don't see the light, but it is daytime because I'm moving. Eat healthy, try to see a therapist if needed, because then you can handle the stress better. Meditation can be helpful too, whereas that's another way to deal with the stress. Try to find things that you enjoy doing, because with as the seasonal affective disorder, as it progresses, you might notice that you have less interest in doing things that you enjoy doing most. So be aware of that so that you can schedule those things, plan those things better,
All right,
and
awesome.
then get
Now,
on top of it.
I know you talked about some of it already. My next question: treatment. I'm seeing some of the preventive could also help with treatment, but generally
Yeah.
speaking, of course, these are medical suggestions. We do recommend that you schedule an appointment with your own doctors, clinicians, to help come up with a customized plan for you. But what are treatment options for someone who struggles with this?
So as soon as so it's a recurrent illness. So after 2 episodes, you kind of know, okay, yeah, winter
Mm,
hits me hard. go to your primary doctor, go to your psychiatrist, and there are treatments for it. So because like serotonin is affected as a
Mm,
in the mechanism of the development for seasonal affective disorder, SSRIs have known to work. So starting somebody on medications during the fall winter period would help. The light box in conjunction with the medications also help. And then
mhm,
another evidence-based treatment is therapy, different forms of therapy, like cognitive behavioral therapy, where people, help with the help of the therapist, they can kind of challenge their negative thought processes, or even thought processes related to the cold and the winter. For example,
mm,
like I was listening to someone saying like their husband just moved from California and to Utah, and they're like, okay, no, it's too cold. I'm not leaving the house. No, but if you dress up properly, you can and still have that 20-30 minute walkouts, and that will help you with a seasonal affective disorder. Therapists can also help with making a personalized plan of what is it that you can do during the winter
mm,
months to keep
mm,
get you going, to kind of okay, are there leisure activities you can schedule? What self-care activities can you do? What activities can you do to even get out of the house, or what routines can you adapt? Or even just to stay adherent to the light box, because people often forget they started um,
mhm,
and then they're like, oh gosh, tomorrow I'll do it. But then schedule it. The best time to do it is early in the morning, as early as you can, to kind of let your body know that it's okay. We are up. Let's wake up. Let's get going for the day. Um, so just those three things are what they can actively pursue. But then on top of that, like we mentioned, have like taking the walk outside as much, get natural light as much as you can on days that you can, on days there is natural light. Get some exercise going, eat healthy, because in seasonal affective disorder we tend to crave carbohydrates and then gain weight and then get depressed
mm.
more because now we have gained more weight. So trying to eat healthy can help as well.
Awesome. A lot of useful information. And I like how you mentioned using the light box early in the morning and scheduling it. So that way you know that that's what you need to do. It's like medication, take it every morning, turn it off on every morning. So this is good. For those of you who are watching live, please you can comment in the section as well. Let us know you're here. And also you can tag people in the comment section as well. Those who could find this very, very useful. Now that being said, Doc, I have people who are watching who are like, wow, I like the way you explain this. It explains some of the things that I may have been going through, and I plan to talk to my doctor about it. And they're wondering where they can connect with you to find out more information about this and other treatment options that you mentioned earlier, even for those who have medication resistant or treatment resistant depression. Doc, where can people find you?
Okay, so you can find us on TikTok at Joyful Horizon, uh, and also on Facebook at Joyful Horizon. Our website is joyfulhorizon.com, and then you can email us there. It's joy@joyfulhorizon.com. And then you can also call us. We have two offices in Utah. One is in Salt Lake County in West Jordan, and one is in American Fork in Utah County.
Awesome. You're in Utah. Whew, it is cool there. And I put that information down here for those for people to connect with you as well. I didn't include the TikTok, so it's down here as well. Website, TikTok, Facebook at Joyful Horizon. She's all over the web. Thank you so much for coming, Doctor. This has been very helpful, and I appreciate you taking the time this Tuesday afternoon or evening to talk with us.
Thank you so much for having me. It has been an honor.
All right, awesome, awesome. All right, thank you all for watching. As always, caring, sharing. Please forward this, email this, copy the link, and send it to those who could find this very useful. And as always, if you or anyone you know is looking for an awesome, a thorough, and a passionate family physician in the Mansfield, Texas area, I am she. Have a good one, everyone, and thanks for joining. Thank you, Doc.
Bye. Thank you.
Bye.